Okay, now we're going to go into the vision screening portion of the training. When giving a vision screening, it's really important to explain to the patient what a vision screening is. And the reason for that is because a lot of times patients and even med students confuse the difference between a vision screening and an eye exam. I've caught some med students saying, hey, would you like an eye exam? Or hey, now these volunteers are going to take you and give you an eye exam. So it's important to clarify with volunteers and then also with the patient so they know this is just a screening. So the definition of a vision screening is testing asymptomatic people for eye diseases and referring those who are suspect for eye disease or refractive error to an eye care professional. Key differences between a screening and an eye examination are that a screening identifies people at high risk. A screening may detect eye diseases in early or treatable stages. Eye screenings provide valuable information and result in a referral. An eye examination, however, is where a patient gets examined for eye diseases or disorders. It can result in a diagnosis or prescription of appropriate treatment. There are 4 steps to a vision screening. You can see them on the slide. It's really important to note that patients can be referred at any point during the screening process.
Hello, I'm Jasmine,
Hey.
and I have a form for you to fill out. I was wondering if I could get you to fill out the top part here, the middle section, and then I have a few questions right here, and then at the bottom there's a place for your signature. Okay?
Hey, thank you.
All right, thank you.
Ms. Turner?
Oh, we're here.
Hi, how are you today?
Hello, I'm good.
You're good? Alright. So you're here for a vision pre-assessment.
Vision?
Vision,
I
yes.
came here to see a cardiologist.
I know, but at the Physicians Free Clinic, what we do is for all new patients, we have you guys go through an initial vision screening. It is optional, however, we do recommend it. It gives us a chance to see if there's anything wrong with your eyes, and then gives us a chance to schedule you with an optometrist or an ophthalmologist to get eyes checked out.
Oh, awesome, because I haven't been to the eye doctor in so long. This is going to be great. Okay, so what do I do?
So what I need you to do is go ahead and fill out your basic information up here, and then if you could answer these 6 questions, and then give me an autograph and date.
Okay, thank you.
During the registration process, you have the patient complete an adult registration form, which has a lot of different questions, and it requires some demographic information. During this phase of the adult vision screening process, you provide the patient with directions for proceeding to the next station or the next step in the screening process. So basically, it's really important to keep the patient informed of what's happening and what's going to happen next. Another critical aspect of the registration phase is that the adult registration form is filled out completely and accurately and clearly. So please, before you go on to the next stage or step, you check the form, make sure they filled out all the information, make sure you can read it and it's clear, and make sure they have signed the form. On the registration form, there are a set of risk assessment questions, and you can look on the screen and see several of the questions that are asked, including, does the patient have any blood relatives with glaucoma? Have they been treated for glaucoma? Have they ever had an eye injury or eye surgery? And have they noticed a change in their vision in the last 12 months? These questions are important because they're assessing a patient's risk for an eye disease or eye disorder. For example, if a person has had a previous eye injury or eye surgery, that can increase their chances of developing cataracts. Another important thing to mention is it's really important to ask follow-up questions after the patient fills out the risk assessment questions. The reason for that is because in regards to the question about a family history of glaucoma, some patients might say yes, but they don't really know what glaucoma is. One question in particular that's really important to have follow-up questions to is if the patient says yes for the question, do you have persistent pain in or around the eye? Sometimes patients might complain that they have pain in their eye, but it's intermittent, like they only have the pain when they're reading. Sometimes the pain might be related to sinus infection. So it's really important that we kind of understand, what type of pain they're having, when it started, etc. If a patient is having persistent pain in and around the eye and it's acute, they should probably be sent to the emergency room because it could be something very serious like the retina is detaching. When I was doing vision screenings in Columbus for a free clinic down there, I had a patient that came into the clinic to get a vision screening, and he complained of sharp pain in and around his eye, and he said that he had acute vision loss. So within the past 3 days, his vision changed dramatically. We immediately sent him over to the ophthalmologist because at that clinic we were lucky enough to have eye care professionals on site, and the eye doctor found that the man had glaucoma, and so he was immediately referred for services to stop the progression of the disease. So again, you're not going to have a lot of patients with that dramatic of issues, but it's just important to have those follow-up questions to determine, where their symptoms coming from, what's the severity of those symptoms, and it's always important that if you don't understand something, clarify it with the doctor, with a fellow volunteer, but follow-up questions are critical. It's really important to make sure the patient reads the statement on screening and that they sign it. Basically, the statement on screening is asking the patient if we can share information pertaining to the results of their screening with Prevent Blindness Ohio. They can refuse to sign it, but it's important to know that Prevent Blindness Ohio is the one giving them the free services. It's also important to note that for the risk assessment questions, if a patient answers yes to 2 of those questions, that's going to be means for referral to an eye care professional. So again, if they say yes to 2 or more of the risk assessment questions, that is a means for referral to an eye care professional.